Welcome to South Georgia Career Center's Medical Assistant Course, Chapter 4, Respiratory System. Contents in this chapter are: Respiratory System, Common Medical Conditions, Apnea, Asthma, Bronchitis, Diphtheria, Measles, Pneumonia, Scarlet Fever, Sinusitis, and Tuberculosis. Anatomy of the respiratory system. The term respiration refers to the act of breathing. Inspiration, inhaling, taking in oxygen. Expiration, exhaling, giving off carbon dioxide. The respiratory system consists of organs that are involved in the exchange of gases. These organs are: nose, oral cavity, mouth; throat, pharynx; voice box, larynx; windpipe, trachea; bronchi, lungs. Furthermore, the respiratory system is divided into the upper and lower respiratory tracts. Upper respiratory tract. The upper respiratory tract consists of nose, nasal cavity, frontal sinuses, maxillary sinus, sphenoidal sinus, ethmoidal air cells, larynx, trachea. Lower respiratory tract. The lower respiratory tract consists of lungs, bronchi and bronchioles, airways, alveoli, air sacs, organs of the respiratory system. The following contains information about each of the different organs of the respiratory system. Nose. Air can enter through the external nares, nostrils. Inside each nostril is an expanded vestibule that contains coarse hair. The nasal cavity is divided by a midsagittal nasal septum. Nasal, frontal, maxillary, ethmoid, and sphenoid bones form the cavity walls. Hard and soft palates form the nasal floor. The external part of the nose consists of cartilage, forming the bridge and nose tip. Superior, middle, and inferior nasal conchae project from the cavity walls. Space between the conchae are the metases. Internal nares open in the nasopharynx, pharynx. The pharynx is a chamber that is shared by the respiratory and the digestive system. Extends between internal nares and the entrances to the larynx and esophagus. The pharynx is lined with a stratified squamous epithelium. The pharynx is divided into three areas: upper nasopharynx, middle oropharynx, and the lower laryngopharynx. The nasopharynx contains the pharyngeal tonsils in the posterior wall as well as the openings of the eustachian tubes and lies above the soft palate and is a passage for airflow coming from the nasal cavity. The oropharynx extends from the soft palate down to the base of the tongue. The laryngopharynx includes the area between the hyoid bone and esophagus entrance, larynx. Joins laryngopharynx with the trachea and consists of cartilages. Three main cartilages are thyroid cartilage, epiglottis, and cricoid cartilage. Other cartilages in the larynx are coroniculate, arytenoid, and cuneiform cartilages. The epiglottis closes while swallowing, therefore preventing food from entering the respiratory system. Coughing is a protective reflex to protect from irritants or foreign objects. Trachea extends from the larynx space and is lined with pseudostratified ciliated columnar epithelium. A tubular structure that is located before the esophagus. Along the trachea are pieces of tracheal cartilages. Tracheal muscle holds these cartilages together. As the trachea branches, it forms left and right primary bronchi. The primary bronchi branches off into many secondary bronchi. The smallest passages are called bronchioles, bronchi. The tracheal tube once divided into two, forming the left and right bronchi. The passage that allows air into the lungs. Left bronchi are further divided into two lobes. The right bronchi are further divided into three lobes, lungs. Pair of organs in the pleural cavities. The top of the lung is called the apex. Each lung has a hilus, a slit where lymphatics, nerves, and bronchial tubes reach the lung. The lung is divided into lobes, where the right lung has 3 and the left lung 2. The left lung is divided into superior and inferior lobes. The right lung is divided into superior, middle, and inferior lobes, pleural cavities. The pleural cavity is lined with a serous membrane called the pleura. Parietal pleura lines the thoracic wall, mediastinum, and diaphragm. The visceral pleura covers the lung surface. Common medical conditions. The following contains information about some of the different medical conditions of the respiratory system. Apnea, also known as respiratory arrest. A condition where breathing has slowed or completely stopped. Common causes for apnea include asthma, choking, pneumonia, premature birth, seizures, cardiac arrest, and drug overdose. If apnea occurs, artificial respiration is required. Artificial respiration refers to the measures to cause air to flow into the lungs by the expansion of the chest cavity. Asthma. Bronchial asthma. Narrowing of the airways. This narrowing leads to difficulty breathing. Cardiac asthma. Occurs in left ventricular heart failure. Treatment for asthma includes bronchodilators, usually in form of aerosol inhalers. Bronchitis. Acute bronchitis. Condition is caused by bacteria or virus. Chronic bronchitis. Associated with smoking and emphysema. Symptoms include coughing and or coughing up excessive mucus. It may be treated with bronchodilator drugs. Diphtheria. Acute infectious disease. Spreads through respiratory drops of coughing or sneezing. Symptoms may include coloration of the skin, heavy cough, drooling, difficulties breathing, or rapid breathing. The Schick test can be used to determine immunity for diphtheria. Treatment may include bed rest, heart monitoring, or breathing tubes. Measles. Contagious viral infection. Spreads by contact with drops from the nose, throat, or mouth from a person infected. The most infectious stage is the coryzal stage. The incubation period for measles is between 8 to 12 days. Symptoms include cough, fever/chills, runny nose and or muscle pain as well as light sensitivity. Diagnosis can be made by measles serology. When caring for children affected by measles, it is best to protect the eyes from direct exposure to light. Treatment, in general, is done by medication to treat the symptoms. Pneumonia. Common infection of the lung. Causes for pneumonia include breathing in germs directly into the lungs, bacteria, and viruses, with bacteria being the most common cause. Symptoms include fever, chills, cough, and/or shortness of breath. Pneumonia can be diagnosed through physical examination by using a stethoscope to hear abnormal sounds and/or an X-ray of the chest. Antibiotics may be used to treat pneumonia. Scarlet fever. Infection caused by the bacteria Streptococcus, strep throat. Symptoms include fever, rash, sore throat, and/or a swollen tongue. Physical examination or throat cultures can diagnose scarlet fever. The Dick test may be used to determine susceptibility to scarlet fever. Treatment usually involves antibiotics. Sinusitis. Inflammation of the sinuses due to viral, bacterial, or fungal infection. Sinusitis can be acute, subacute, or chronic. The most common causes are colds and allergies. Symptoms include nasal congestion and discharge, fever, sore throat, and/or cough. A physical examination may be done to diagnose sinusitis. Treatment may include allergy shots or nasal sprays. Argyrol is often used to drain sinuses. Tuberculosis. Contagious infection of the lung caused by bacteria. The highest incidence of tuberculosis occurs between the ages of 15 to 30 years. Symptoms may include cough, fatigue, fever, and/or coughing up blood. Tests for tuberculosis include biopsy, the use of a bronchoscope to examine the lung, CT scans of the chest, and or X-ray of the chest. Treatment is done by medications, including isoniazid or rifampin,